If you or a loved one is navigating a liver cancer diagnosis, you already know it's a journey, and it can feel pretty overwhelming. Today, we're going to dive into some of the incredible research out there, not to replace medical advice, but to give you the tools to feel more empowered. And really, it all comes down to this one question, doesn't it? What if you could be more than just a patient? What if you could be an active, informed partner in your own care, bringing real research to the table to discuss with your doctor? Let's see what that could look like. Okay, but right up front, we have to be crystal clear about this. Nothing we're about to discuss is medical advice. Seriously, please don't make any changes to your treatment or your health regimen without talking to your doctor first. Think of this as a bridge. On one side, you have all these complex, dense research papers. On the other side, there's you. Our goal is to connect the two, to give you a guide so you can have a totally different kind of conversation with your oncology team, a real collaborative one. So let's get into it. We're going to act as a pathfinder, helping you sort through this huge world of scientific studies to find what might actually be relevant. And the first step on any path is, learning the language. And here's a super important term you'll hear a lot: complementary care. The key word here is alongside. These are things you do with your standard medical treatment, like chemo, immunotherapy, or surgery. They are never, ever a replacement for it. It's also really helpful to know where the info is coming from. So you've got direct evidence, that's the gold standard. We're talking human clinical trials analyzing real patient data. Then there's indirect evidence, like studies done in a lab. Still super valuable, but it's an earlier piece of the puzzle. We'll be looking at both today. So, how does this actually play out in the real world? Let's dive into our first big area of research, looking at how some surprisingly common medications might just help standard treatments work even better. I know, it sounds a little wild, right? An allergy pill? But believe it or not, some of the most compelling research is looking at a class of drugs you'd never expect: antihistamines. And this number right here, 2x, this is where things get really interesting. What on earth could this mean when it comes to liver cancer treatment? Well, it comes from a study of patients taking a targeted therapy drug. When they added an antihistamine to the mix, the percentage of patients whose tumors either shrank or stopped growing nearly doubled. And get this, the need for them to lower their dose because of side effects was cut in half. Pretty incredible. And here's another jaw-dropper. Just look at this chart. It shows a study where just adding a low-dose aspirin was linked to a 43% increase in relative survival. The source material for this chart even points out that for this group, it more than doubled their average survival time. I mean, these are exactly the kinds of powerful findings you might want to talk about with your doctor. All right, let's shift gears to a topic that is, frankly, on every patient's mind after a successful surgery. How do you stop the cancer from coming back? This is where the research points us to another really common medication: statins. Okay, just take a look at this. This chart shows the findings from a huge analysis of patient records after surgery. So after 5 years, the recurrence rate for patients not taking statins was about 60%. That's 3 out of every 5 patients. But for the group taking statins, it dropped all the way down to 20%, or just 1 in 5. That is a massive difference. And just so you get a sense of how solid this research is, that finding comes from a massive analysis of over 44,000 patient records. This is not some small preliminary study. This is a powerful look at real-world data. And the source material adds another interesting little tidbit to this whole conversation. It notes that for people who might not have a prescription, red yeast rice is actually a natural source of lovastatin, which is a type of statin. Again, just a really fascinating point to bring into that informed conversation. Now, the research goes way beyond just repurposing common drugs. It also gets into diet and natural supplements. So let's do a quick lightning round of a few other findings just to show you how broad this world of research really is. Let's start with your morning brew. Believe it or not, one study of liver transplant patients found that drinking 3 or more cups of coffee a day was linked to a 70% lower risk of the cancer coming back. In fact, in that specific group, the data showed 0 recurrences. Wow. Then you've got mushroom extracts, things like turkey tail or extracts from shiitake mushrooms. There are multiple studies suggesting they can help support and balance the immune system, and some data even points to potentially slowing down progression in more advanced stages. And finally, there's gentian, which is a really well-researched herbal extract. A meta-analysis, which is basically a study of a bunch of other studies, found that when Denshin was added to standard chemotherapy, it was associated with a risk reduction of over 50%. Phew, okay, so we've covered a lot of ground, right? From allergy pills to aspirin, statins to coffee. So what does it all mean for you? Where do you possibly go from here? Well, this is all about your empowered next step. Let's just do a quick recap. We saw research where antihistamines were linked to making treatment work better. We saw aspirin associated with increased survival time, and we saw how statins were connected to slashing that recurrence risk from 60% down to just 20% in one major analysis. These are the kinds of big picture takeaways you can bring to a conversation. And it all boils down to this really simple 3-step process. First, explore the research for yourself. Second, figure out what key questions are most relevant to your specific situation. And third, the most important step of all, partner with your oncologist to talk about what you've learned. And that really leaves us with this one final thought. Look, this isn't about searching for some magic bullet. It's about changing the whole dynamic of your care. Just imagine what becomes possible when every single patient feels empowered to be a true research partner in their own journey. Thanks for joining me.